Hi, good afternoon. Today for my oral exam, I will be participating as a nurse with glasses, and whenever my glasses are off, I will be the patient. I'll get right into the video right about now. Hi, good afternoon. I'm Nurse Bella. Let's start with some personal information. Can you tell me your name, age, and occupation? Hi, good afternoon. My name is Alexa Martinez. I'm 27 years old, and I'm a delivery driver. Thank you, Alexa. But before we continue, can I ask you about some allergies you may or may not have? Yeah, of course. I'm actually allergic to penicillin and shrimp. Whenever I take penicillin, it gives me like an allergic reaction with hives. But whenever I eat shrimp, it gives me a different reaction. I have trouble breathing whenever I eat. Okay, that's great to know. I'll just note that down on your chart. But I'm going to get started on taking your vital signs for right now. Oh yeah, sure, that's okay. Okay, I've just taken your vital signs, and it shows that your temperature is of 37.1 Celsius, and you have a heart rate of 88 BPM, along with a respiratory rate of 18 per minute. Your blood pressure is of 122/78 mmHg, but everything looks stable. You're okay. It's just a little bit elevated and from the discomfort that you're experiencing. But everything's completely normal, apart from that. Could you just be so kind as to describing exactly what happened during the accident? Oh, okay. And yeah, of course, I actually slipped as I was unloading a heavy box from the trunk. And as I was coming down, my foot got twisted and I fell sideways. As I fell, I hit my arm against the trunk, and I guess after that, my left ankle swelled up. It was like it was inflated in itself, and my forearm actually ended up getting kind of bruised. It still kind of hurt. Okay, well, based on my assessment, you just sprained your ankle, and you just have soft tissue on your forearm from the bruise. I'm going to just give you some instructions on how you can take care of yourself after you leave the hospital, and you can take care of yourself at home. Oh, okay, that's not as bad as I thought it would be. And yeah, sure, of course. Okay, well, just as a treatment, I would love for you just to avoid long walks or carrying heavy objects for at least 72 hours. And along with that, for the first 2 days, just apply ice every 15 to 20 minutes for at least every 3 hours. And as to keeping your ankle comfortable, I would love for you just to use compression or elastic bandage. And try and keep your ankle elevated for as much as you can as you're sitting or you're lying down. And I understand it might be hard due to the fact you're delivering and you're in the truck most of the time of the day. Now, as for the pain, due to the fact you're allergic to penicillin, I would love for you just to take an ibuprofen only every 8 hours and only if needed. But before you take it, make sure you always eat a meal or have some food in your system. If you ever notice a fever, extreme swelling, numbness, or difficulty walking, make sure you come back immediately. Going into your diet, just make sure you have lean proteins, vegetables, along with fruit, some dairy if you're not lactose intolerant, and along with whole grains, just like oats, brown rice, or even whole wheat bread is good. Make sure you have healthy fats like avocado, olive oil, or even nuts is a healthy fat, and it's great for your system. Make sure you stay hydrated by drinking enough water. Don't try to avoid sugary drinks or like Coca-Cola, Sprite, along those lines. Besides the sodas, try to avoid energy drinks along with greasy or fried food. I understand it might be hard due to the fact you're a delivery driver, but there's always a healthy option. Try to avoid excess sugar or even alcohol, as it can affect your tissue healing. Oh, okay, thank you, nurse. I'll follow everything as carefully as I can. As for my ankle, I'm kind of nervous, but I'm sure I can do it as I'm on the road. Okay, perfect. Thank you, Alexa. Watch your ankle and please stick to the diet. If anything, come back in 5 days for a follow-up and try and make sure you follow the instructions that I've laid out in your treatment plan as carefully as possible.